Hi, I'm Esther, and I'm a child and family health nurse. Today we'll be exploring the why, when, what, and how of starting solids. This is a new adventure for you and your baby. Why do we start solids? At around 6 months, your baby's nutritional requirements change. As your baby grows and develops, it needs iron-rich foods to maintain growth and development.
When do we start solids? At around 6 months. Babies must have good head and neck control. Baby can sit up with support. The tongue extrusion reflex disappears. Baby opens mouth when offered food on a spoon. And finally, baby reaches and grabs. What equipment do we need to start making food? We need a high chair, sippy cup, soft spoons, small bowls, airtight containers to freeze meals in, a blender or stick mixer, ice cube tray with Ziploc bags.
Make sure you wash your hands prior to making and serving food. Wash the equipment with hot, soapy water after each use.
What foods do we introduce? The foods we introduce are iron-rich, iron-fortified foods. For example, iron-rich cereals, red meats, boneless fish, pork, lamb, tofu, legumes. Vegetables and fruits, pasta and rice and grains are also important. Full-fat dairy products such as yogurt and cheeses. Remember to offer foods from the 5 food groups. When commencing solids, start with puree textures, then moving on to mashy, lumpy textures. As your child is able to enjoy these textures, move to grated, shredded foods. By 12 months, your baby should be having family foods cut up. Here are some unsuitable foods. No honey or raw eggs. Don't give soft drink, juice, tea, coffee or flavoured drinks. Avoid hard foods. No added sugars, salts to home cooking. Processed foods, for example, cakes, biscuits, chips and deli meats. Full-strength pasteurised cow's milk in food preparation is okay, but not in a cup to drink till after 12 months. Breastfeeding and infant formula are important components of a healthy diet. Supervise your baby at all meal times.
Roman is showing interest in his solid food by looking at his food and opening his mouth. He's also leaning forward, wanting the spoon. Roman is now showing signs of having enough solids. He's losing interest. Don't force food. Follow your baby's cues. Offer cool boiled water in a cup with a spout with meals. Here are some examples of healthy finger foods you can offer your baby. Make sure the consistency is age appropriate. Supervise your baby at all meal times.
Do I need to start with rice cereal or can I give my baby breakfast cereal?
No, you can use ordinary ground or brown rice, which when cooked is smooth. You can offer breakfast cereals that do not have any added salt or sugar. For example, a porridge or a wheat-based product. You may need to add a small amount of breast milk or full-fat milk or yogurt to the cereal.
How does my baby's day plan out when we start solids with milk feeds?
When starting solids, offer milk first. Only small amounts of food are introduced initially once a day. Increase amounts and varieties of foods as baby enjoys, progressing to 2 and then 3 meals a day. Cooled, boiled water can be offered in a sippy cup with meals. Milk can then be offered after solids when your baby is on 3 meals a day.
What foods should be avoided?
No honey or raw eggs before 12 months. Avoid hard foods. Food allergies in families are a concern. Recommendations encourage offering these allergy foods in small amounts in the correct texture. Watch for reactions and seek advice from your local doctor if a reaction occurs.
What solids should be given after 12 months?
Your child should eat a variety of foods from the 5 food groups, the same as the rest of the family. No salt or sugar should be added to the food. Make mealtimes enjoyable. Children should eat with their family. Offer milk and water in a sippy cup with meals. Continue to breastfeed or transition from formula to cow's milk in a cup from 12 months.
How will I know whether my baby is choking or gagging?
Gagging is a normal reflex that babies have until 6 months and will occur as they are learning to eat solid foods. It's normal for babies to cough and splutter or even vomit if food is too big to swallow. Gagging is not the same as choking. Choking is when the airway to the lungs is blocked or partially blocked. and your baby can't breathe or cry. So never leave your baby unattended while they are eating. Have fun as your baby explores new foods and textures, and remember babies are individuals, so some babies eat enthusiastically and others will take longer to want more than just a taste. Introducing solids is more than just food. It's a great time to talk, listen and observe each other. For further information, visit your early childhood health clinic or your local GP.